have to experience, because those stigmas can affect us, right? So stigmas with mental health can keep us from actually going to get help and going to get treatment, because we continue to suppress those feelings, those thoughts, and oh man, I'm okay. It's not a big deal. I can just work my way through it. Sometimes we can't. Sometimes we need extra help. We need talk therapy, or we need to work with a psychiatrist so we can get our physiological, our bodies in the right state of mind, whether it be through medication or some type of support in that nature, right? If we need medicine to help us. So if we're gonna make this distinction, because we want to make sure that you get help if you need it, right? So we got to debunk this myth, these stigmas about that if I have a mental health concern, then that designates me as crazy. It's just not true, right? So when we succumb to these myths or these stigmas, we don't go get help, number one. Number two, then we're not willing to open up and talk about what we feel. How many times have maybe you been going through an episode or an experience or adversity, and because you didn't feel comfortable talking to somebody about it, you just kept it to yourself and tried to work through it? We all have at some point, and that's not the right way to make sure we're maintaining and we're improving our mental health. We got to be able to open up and have these conversations, right? If we don't do that, then you can, or a person can tend to isolate themselves from friends, family, activities, roles, whether it be job or school. People can separate themselves, start to fall to the wayside, right? Because you're going through something emotionally, mentally, and then you're not able, or you feel a lot as though you don't have anybody who cares, who understands, who's going to listen, who wants to support. So then now you start to pull back, and now that can lead to or manifest itself into a more serious condition if not addressed. Just like your physical health, your mental health has to be maintained, taken care of, acknowledged, and supported, right? There are some things that we can do to help get rid of these myths, right? We want to make sure that if you need help, go get treatment, go get help. You got to open up, be willing to talk to somebody who you feel safe with. You got to have one person who you feel like you can go to, right? Sometimes there may be instances where you feel like there's nobody you can go to. You know what? Jump on Google, jump on the internet, type in your zip code, type in therapist, reach out and try to find a mental health professional who may be able to provide some support, some assistance to you, right? We also want to be able to reduce the shame, right, and the self-doubt that comes along with the stigmas surrounding mental health. So we want to make sure that we are reaching out for help. We're having those conversations. It takes a lot of courage, right? It's not weakness, it's courage to say, man, I'm not okay. I don't feel good. I've been going through it. I've been having a hard time, whether it be with a relationship or work, or just your physical health is not going right. And so that's affecting your mental. We got to be okay with saying, I'm not okay. And we got to be able to have that conversation and open up to people about what we really need, right? We don't want to isolate ourselves. We want to connect ourselves to people, whether it be a mental health professional locally in your area. Maybe you need to connect with somebody on Zoom, right? We're all on these Zoom calls. Maybe you need to connect with somebody maybe in your church, wherever you can find that support. We need to find that for you. There are also support groups out there, right? So we got to make sure we understand that there are support groups that are willing to have you come in and just sit and listen, right? Listen to other people's experiences, their journeys, and how they overcame what they've been through. So there are a lot of different avenues to help you if you're having some concerns or issues with your mental health. We all are going to have those types of issues at some point, but we got to make sure that we acknowledge them and we address them in a timely fashion, in an appropriate manner, so that they don't manifest or turn into something bigger, more serious, more damaging, which can have long-term effects on your mental wellness and also your physical well-being and your relationships around you, right? So let's start there, right? I think, what do you think? Does that make sense? Leave comments down below if you know what I'm talking about, if you have questions or concerns about the differences between mental illness and mental health. Last week, we talked about why mental health is so important. We started the conversation with why mental health is so important to the Black community, because we need to have this dialogue. It's important. We talk about everything else. We talk about money. We talk about videos. When we talk about entertainment, we talk about sports. How come we can't have this conversation about your emotional, your mental, your social well-being? We got to do that. When you know better, you do better. So this is a part of that process. Just having grown-up conversations, even with our family, our friends, with our kids, about how important and valuable they are. And it starts with your mental health. So that's all I got for today. Hopefully you found this interesting. If you have a conversation or you have a topic that you want me to address, leave it in the comments. I'm going to read them. I'll try to address it next week. And we'll continue to have this dialogue, this conversation ongoing, right? About mental health and how it affects our community. Again, remember, like, subscribe, notifications, right? Follow us on Facebook under Black Mental Health. My name is Harold Rayfield. I'm a licensed professional counselor and therapist. Thank you for this opportunity just to start this dialogue with you. Thank you for listening. You have a wonderful weekend and continue to enjoy Black History Month. Thank you.